when we talk of developed world and healthcare, US is the main benchmark. And I always refer to US as a mecca of medicine. And if we see healthcare industry in US, it is maybe number 2 or number 3 industry, because the industry size in US is close to $1.7 trillion. When we talk about per capita spent on healthcare in US, it is more than $6,000. When we come to UAE, the per capita spent on healthcare is close to $1,600. So we see a huge gap there, and we see huge opportunity there. And when we go close and study the healthcare scenario here, we see now the latest population, as per the published census by Gulf News, we are talking about 8 million population. And for this population, if we see supply-demand situation of healthcare, we find that there are not enough hospital beds. If you talk about the WHO set standards, and the benchmark is that you should have 1 hospital bed for every 250 population. And when we analyze the supply situation in UAE, we find that there is 1 bed available for every 650 to 700 population. So actually, in next 5 years, we have to double the supply. What is happening in Abu Dhabi? Abu Dhabi, they have made the health insurance mandatory. That means everybody has access to healthcare, which is a fantastic thing to do. Now what has happened is, we see a dramatic change in Abu Dhabi healthcare scenario. Small hospitals are seeing more than 2,000 patients per day in outpatients. And actually their capacity is 500 to 700 patients. And not a single hospital bed is available to people at certain time. So actually in Abu Dhabi, if you see, you have to double the supply, then only you will be able to provide. Because what has happened is, in US, when privatization of healthcare happened during 60s, so what they did was, they created an accessibility bridge. So they privatized insurance at the same time. So people had access to private healthcare. Now what is happening here is, 70% of the healthcare is in government sector. Only 30% is in private sector. Now, there was a time, I have been around for more than 10 years, and there was a time when I was watching very closely. I am a very close student of healthcare. And we have seen the government was losing huge amount of money on the maintenance of the health of expatriates, for which it does not have actually any obligation, because it is the obligation of the employer who is bringing this workforce into this country. They should also try and manage healthcare for them. Now things are changing. Abu Dhabi has opened private insurance, and Abu Dhabi has made it mandatory. So that is the situation we are witnessing there. Lot of private institutions are coming up, and hopefully during the next 2-3 years, the supply should match the demand. Coming back to Dubai and Northern Emirates, still the insurance is not mandatory. Around 25 to 30% of the population has private insurance. Rest of the people still depend on subsidized government healthcare, or they go back to their country of origin and get treated there in a subsidized packages. Now what is happening, based on our discussion with the Ministry of Health and the different health authorities here, it is likely that during the next 1 year, the insurance is going to be mandatory. Once it is mandatory, then there will be a huge gap in supply. So opportunity is tremendous, not only for hospitals, yes, for clinics, for medical equipments, for pathology lab, for everything pertaining to healthcare. And this is one of the most promising industries. You know, when I was with Apollo Hospitals India, my mentor, the chairman of Apollo Hospitals, always used to tell me and tell everybody that there is a tremendous opportunity in healthcare, and it is going to happen. Because what he used to say was that 30% of Indian population is equivalent to the entire population of US. And in US, the healthcare industry is $1.7 trillion industry. That means within India itself, you have US existing. 30% middle class, which has buying capacity. If if accessibility created, they can have access to the best possible private healthcare. That means there is opportunity for $1.7 trillion healthcare industry in US itself. So is true for the entire region, because we are growing, the middle class is growing, and lot of awareness has come now. People know if I don't take preventive measures, the healthcare bills are going to be huge, because this industry is highly advanced industry where technology matters. Because you can't say that once upon a time I was world class, today I don't have money so I'm third class. Nobody is going to come to you. You have to update the technology every day. For that, money is required. Government, it is not advisable and it is not viable for governments to invest that kind of money into healthcare. It has to be run on par with other industries. So private entrepreneurs have to come. Accessibility bridge has to be created through private insurance, and then you can provide the latest to the patients. I see a great future and opportunity for healthcare in this region, and I'm sure within next 5 years you are going to see a sea of change in healthcare delivery system here. One more thing which is very, very important. Medical tourism is coming up in a big way, and this is going to become a $20 billion industry in the region. Because what has happened, that after September 11, 2001, people have either stopped going to US, or somehow visa restrictions, they find it very difficult from this region to go. Dubai and UAE is the ideal location for that, because medical tourism looks for two things. Primarily for a good quality healthcare, but also for good infrastructure and hospitality environment. Dubai and UAE is known in the region for top of the line hospitality standards. If we can bring in top of the line healthcare providers in this region, this place is ideal destination for medical tourism.